One of the biggest challenges I deal with is when a patient has multiple wounds. What I mean by this is having either pressure ulcers, other type of wounds on different body parts, meaning on the hips, the buttocks, or the sacrum. We refer to the buttocks, it's kind of the posterior thigh, or we call the ischium, which is a more technical term, or the hips. It becomes very difficult to manage these patients because you don't know which way to turn. If you have one on the left hip and one on the right hip, you have to offload, meaning you have to turn back and forth, and it's very difficult. At some point, one wound is going to suffer while the other one's doing okay, and then vice versa when you're switching. A lot of my patients have a pressure ulcer on the sacrum, or it's on the coccyx or tailbone right back here, and one on the hip. So you have to adjust and reposition and so forth. And it becomes very challenging because invariably there's always going to be pressure on the wound, which will impair wound healing. As I was always discussed with the 4 Ps, pressure relief is the third P in the 4P scenario. So really, it's very difficult and very challenging. Even if you're what's on a group 2 mattress, these are type of mattresses where it adjusts for the weight as well as changing pressure in the mattress, meaning you're not laying on a hard rock. So what is the solution to this? Well, there's a type of bed called the Clinitron bed, or a group 3 bed. That's the medical terminology for it. This is a bed that is a sand immersion bed. It has sand particles which kind of floats. You're almost submerged in what we call a sand bed, where you don't actually have to turn the patient, which is beautiful for patients that have multiple pressure ulcers. Now, one of the challenging things is getting insurance to cover it. Some people pay out of pocket. It becomes very expensive. It ends up becoming $5,000 a month to rent, and to purchase it's about $85,000 to $100,000. That becomes very unwieldy, even if you do have resources, and there's an enormous amount of learning how to use the bed appropriately. So I have several patients that are on a Clinitron bed because they have multiple pressure ulcers, and a lot of the caregivers and nurses have difficulty turning the patient. It's not uncommon for the ethos representatives to tell the caregivers, the family, and the nurses to turn the bed when the bed is off. It's very challenging to turn a patient when the bed is off, meaning you're basically on a hard mattress. So I always recommend turning the patient when the bed is on. You're kind of in a free floating, almost like a water bed. It's actually very easy to turn with a draw sheet or white sheet. You're able to use kind of a system where you can kind of use a sheet to pull and turn the patient. Then once I'm ready to get the patient in position for either diaper change or a wound dressing change, then I actually turn the bed off. I'm going to show you a video which you can see shortly as how I do this. I can do it myself. I'm not a big guy. I've had patients that are 3 times my weight. I'm able to turn them. And I think it's very educational for me to teach caregivers, family members, as well as nurses how to use the bed to its utmost. Now, one of the important things with this type of Clinitron bed, it's great, as I said, it's great for even just a single wound, but it's really efficient and effective in patients that have multiple pressure ulcers, meaning multiple wounds in different areas on different pressure points, because you don't have to turn the patient in this type of bed. However, as I said, there's an enormous learning curve. The bed has to be in almost an air-conditioned environment, meaning it can't be in a very hot, humid environment. They can have several layers on the bed. So there's a lot of layers, no double entendre intended, that you have to pursue and stick to when you're having this type of bed. The one thing I'm going to go over in this video is how to turn the patient with a draw sheet and how to really do it easily, effectively, and so you don't hurt your back, and then you'll be able to do it by yourself. I hope you find this educational. I want to introduce myself. I'm Bienstock. I'm a plastic surgeon who's board certified. My specialty is wound care. I take care of patients in the home. I'm here to help you and your loved ones. If you have any questions, please reach out. Leave any suggestions for other topics. And if you need help in the New York City, New Jersey, Westchester, Long Island area, please feel free to reach out to me. Make sure you subscribe to the channel, and please share with all your friends and colleagues. Thank you so much. So we have a patient with multiple pressure ulcers. We're going to turn him. I'm going to show you how to turn on the Clinitron bed. The most important thing is to lower the head. Now the bed will slightly go off when we're doing this, so I'm putting it down. Now the key thing is the company or other company will tell you, turn the bed off when we're turning them. I leave the bed on, because right now you can see it's a sand bed, where sand particles. It's almost like the old school water bed. So what I do is, I move the Foley catheter over this way. It was attached this way. I move it over. I do something called a leg crossover. Since I'm a big fan of salsa, we like to do leg crossovers. I use this. This is my pulley. Use a sheet, which is good. We have a draw sheet here. Usually I'll do actually one that's more horizontal. This is more of a vertical one. I actually don't use chucks. Usually I don't use chucks at all, but you can have this. What I'll do is I'll turn them like this. And then what I do is, I have the control here. It's turned already almost over. I make sure I protect the arm. You don't have to come out. Turn them this way. Now you see there's multiple wounds here. And the trick is, I turn the bed off and I compress this all the way as I follow myself. You can see now you can access all 3 wounds. And you can see I'm not a big guy. I was able to turn them all by myself.
Perfect.
So now you can change all 3 wounds. You see I have the leg crossover, the bed is off. Now when you're turning them back into what we call the supine position, you do the reverse, which I'm going to show you. We already changed the wound. This is purely for educational purposes. I put the bed on. We just go in reverse.
Wow.
Undo the crossover. Remember, I'm not a big guy. The one thing that's easier is having a draw sheet. Sherry's having a draw sheet going this way. I like to have one vertical and one this way. That's it. If you need to drag them up, you can use this to pull them up a little bit. And when you want to pull them up too much, remember this right here, I want to show you this in the video. You see this is the soft part. You can get a close up of this. You see the difference? This is the soft part.
Okay.
Right here, this is the hard part. If you look, this is the hard part. So you don't want the wounds on this part. This is basically just like a hard foam. Their head is all the way up here. The wound is up here.
Yeah.
So that's the pizza purpose. You need the wounds on this part of the bed.
In the sand.
In the sand, exactly. Perfect.
Okay.
Perfect description. And that's it. Okay, then we raise the bed up. Key thing is use your remote. Like that. And that's it. Okay, I did that all by myself. The only thing that's easier is if you have a draw sheet that goes in
Across.
along one vertical and one horizontal.
Okay.
Okay? That's it. Okay? How'd I do?
Perfect.